Since the introduction of the new healthcare assistant visas in the United Kingdom and in Ireland, there has been a rise in people who want to become healthcare assistants who live abroad. Some of these people are already qualified, some of these people are studying towards becoming a healthcare assistant, and others as well have not even studied and are looking into study to become a healthcare assistant. A lot of people have reached out to me asking what exactly did I study as a person who has worked as a healthcare assistant. As I go through these modules, note that the names of the modules may be different to what you have done in your country, but as long as you're qualified to work as a healthcare assistant in your country, you most likely can work as a healthcare assistant abroad here in the UK and in Ireland. So without further ado, let's get right into this video. I studied to be a healthcare assistant here in Ireland. I did a total of 8 modules. Of those 8 modules, some were mandatory. That means that you have to do them. It is a requirement by the government to do them. Some of those modules are elective. That means you choose from a list of modules that I would like to do this. I did my healthcare assistant course over 1 year, and it is a level 5 healthcare assistant course. I did it through 2 schools, that is the Ballsbridge College and the Open College. The Open College was online and Ballsbridge College was classroom based. With the Open College, as it was online, I submitted all my assignments online. I never actually attended classes. What happened is that for some of the modules, most of the modules except I think one, that is the work experience module, I submitted assignments and wrote exams, but just for that one module, the work experience one, I just submitted my assignments and there was no exam for that. So the first module we're going to talk about is the care skills module. This module is a mandatory module, meaning that if you studied here in Ireland, you cannot work without it. The main purpose of this module is that you understand how to care for a patient properly, understand their needs, their personal care needs, as well as understanding how to identify a patient and recognize them not only just as a patient, but as a human being as well, and give them that choice, that dignity when you're taking care of their needs. The module itself, I wrote assignments and I wrote an exam as well. I wrote a total of 2 assignments. It's a fairly easy module. Most of the answers are in the casework. By the time you go for the exam, you are well prepared for the exam itself. The next module that we're going to discuss is the care of the older person. As the name says on its own, this is a module that mainly speaks about how to work with older people, how to approach older people in a holistic way, how to understand older people, and at the end of this module, you'll be able to work with older people, especially older people with dementia, understanding their needs and understanding as well what is required of you. This module is mandatory as well, meaning that if you studied in Ireland, you wouldn't be able to work if you didn't have it. It's in a mandatory module. Continuing with mandatory modules, there is a module that I did that was called a work experience module. This module is mandatory as well. So what happened is that you have to acquire a total of 150 hours work experience to be able to work as a care assistant here in Ireland. So what we would need to do is that you would need to put in 150 hours of work experience, depending on where you're studying or depending on your sponsor. You would need to do these modules unpaid. That means voluntary. Most nursing homes or hospitals won't pay you for this, so you would go in there basically it's voluntary. You are not paid anything for it. So I did a total of 150 hours of work experience. You need to keep a diary during this time, meaning every not necessarily, it actually is every day. So every day that you go in, you would need to keep a diary, and you would be given a guideline on what you need to write in the diary. It is mostly to do with what you did on that day, but it is guided, so you would be given a template to work for. You would need to have this diary signed by the people you work with, who you shadow during the course of the 150 hours. You would need to have this diary signed and stamped for each day that you were in for the 150 hours. I know that for some colleges they require you to do 200 hours, but our mandatory hours were just 150. If you want to do more, you can do more. That is up to you. Like I said, it was unpaid. Some nursing homes will offer you a stipend, but mostly it's unpaid, and some nursing homes will offer you food free of charge during this time. This is one of the modules that I enjoyed the most. It is practical and gives you, I wouldn't even say an insight, it gives you such a broad experience of what it will be like working on the floor. Working in a hospital setting or nursing home, it is important that you are safe. So safety is important for yourself, and safety is important for the patients that you're taking care of. Hence, one of the modules that are mandatory when you are studying is safety and health at work. So this is a mandatory module that I had to do. Although this module is mandatory, you could still work as a healthcare assistant with just the care skills and the care of the older person for a limited time whilst you study towards getting the rest of the modules. But it is for a limited time. You do need to get the rest of the modules. You do need to study the rest of the modules. Most colleges will give you a time limit on when you can do the rest of the modules. It's usually you have to do the rest of the modules within a year for you to be fully qualified as a healthcare assistant. But getting into detail more into the safety and health at work, this is a module, as you can see from its name, that talks about safety in working in a nursing home. They will go into detail on what it means to be safe in the workplace environment. When you do your work experience, you will understand this a little bit more, and you'll understand the importance of this module. Wrapping up on the mandatory modules is the care support module. This module is more focused on you as an individual working as a carer. We'll cover things such as understanding the responsibilities and entitlements of a care worker and what is expected of you working as a care worker. You will also learn how to communicate and deal with people as working as a care worker. Like I said again, this module is mandatory, and this is the last of the modules that are mandatory. Now let's get into the elective modules. These are modules that you do not need to do. You do need to do 3 more modules for you to be qualified fully as a healthcare assistant, but this is when you can choose from a pool of modules and choose what you would feel would be best suitable for you. So without further ado, let's get right into these modules. The first module is communication. Who are we if we don't know how to communicate with people effectively in general life and in a healthcare setting? As you work in healthcare, especially as a healthcare assistant, you are the one who deals directly with patients. You're the first point of contact to the patients, and as well you will be dealing with families. So you need to learn how to communicate effectively when working with patients. So although this module is elective, it is a module that I chose, and I'm very happy that I chose, as it taught me the skills on how to communicate correctly with patients, with their families, as well as the rest of the team that I'm working with as well. This module that we're going to talk about is the anatomy and physiology module. I personally did this module as it was elective. I chose it. However, I would say that choose this module if you feel that you would need to advance in your career as a healthcare assistant and possibly become a registered nurse. If that's the career path that you're looking for, then study this module. This module gives you an introduction into anatomy and physiology. Looking back, I feel like I didn't utilize this module in the work setting as much. Yes, there were elements of it that I did use working as a healthcare assistant, but looking back, I possibly would have been better off choosing a different module than this particular module, as it was more centered to a person who would like to work as a registered nurse later on. That being said, still for me it was the perfect module, but if you feel like you would not want to pursue a further career as a healthcare assistant later on, then I would elect a different module. I also did a module called Nursing Theory and Practice. This is a module that talks more about the work ethic as a nurse, the history of nursing. Again, I would suggest this module for someone who is looking to further pursue a career in healthcare, not only as a healthcare assistant, but who wants to work later on as a nurse. This would be the best module for you. But if you just feel like you want to work only as a healthcare assistant, I wouldn't take this module. I would take a different module. You can always add on and study this module on its own later on. And that is it, guys, with my talk on my healthcare assistant course. I will link down below the link to the Open College if you want to go through it and read up on some of the modules that are available in further detail, because if I would have done that, this would have been a very lengthy video. You can check that out, and I will see you in the next video. Bye bye.